Well, talk about being smacked in the face. What's going on here is mind-blowing. Never in my lifetime has, have we had to change our behavior and have this drastic effect on the economy in order to save lives. And, there are people who wish we didn't have to do that. That is fully understandable. This is some very tough medicine, but it's better to take the economic problem where the economy can come back than to allow it to spread throughout the country and take millions of deaths as the price that we have to pay here. And so, yeah, I think this is a smack on the head. This will cost trillions of dollars. They just passed a $2 trillion relief bill, and now they're talking about more. The kind of research to be ready for the next pandemic is a tens of billions number. So it'll look almost trivial compared to the price we're paying now. And that price would have been a lot lower if the world was more prepared. Yeah, the companies like Moderna, CureVac, Inovio, our foundation has been funding them to build vaccines in a somewhat different way. It's an RNA platform that is very versatile. So the amount you have to change is very small, and you can build up your manufacturing so that it is available no matter what pathogen comes along. That manufacturing capacity is there, and certain elements of how you go through regulatory approval, because you're only changing one small piece. You will have had many of these RNA vaccines approved. People understand the safety profiles. So that would mean that in the future, yes, that timeline is less. Because you want things to be safe, and vaccines actually can, in weird cases, do an enhancement of the disease. You really need to test for that. And so I don't think we'll get much below a year. We'll challenge very smart people to work on that. But the trade-off involved there is about the how confident are you that when you're going out and giving this, that there's no side effects. That's right. You'll see a lot of people try to show that viruses, their infectivity and how much they kill, the case fatality rate, those are separate things. And so smallpox is a very bad case because it's very infective and it kills like 30%. Here, fortunately, although there's still some uncertainty, the case fatality rate is something like 1%. If you have a medical system that's able to take care of the severe cases, about 1% of those who are infected die. And yes, it could be worse. This is very, very bad, but still not the worst case. Well, the responsibility to take care of the health of the public, that's a governmental responsibility. And so in the case of testing, those companies aren't in a position to decide who should be tested and who shouldn't be tested. Those are societal priorities. So right now it's fairly chaotic. I said somebody can get a test every day without symptoms, and a medical worker in another location doesn't have access to the test. So the values we have as a society, our understanding of the disease dynamics, and the very finite capacity of the way we're doing the tests now, which is the PCR machines, that is up to the government to get involved with. In this case, state leaders have had to step in and take some responsibility there. But it's kind of unfortunate that we don't have a digital system that's ranking for the finite capacity we have exactly which ones should be taken care of there. And maybe we'll get that fixed or not. Maybe that'll strangely have to be at the state level. But the government is in the role here, and it has to design the system. And then the private sector companies, who own those machines, run those machines, they'll step up, they'll work super hard. The clarity, though, has to come from the federal government. Well, having these markets where you have, bats in a cage and pangolins and things like that, it's fairly clear that the less we have of those, that somewhat reduces the chance, but it won't reduce it to zero. And so you really do need the preparedness system there. And there are so many coronaviruses in animals, it would not have been possible to say, okay, this is the one to be afraid of. We don't understand enough about that how it transforms to cross the species barrier. There are literally millions of viruses out in animals. The number that cross over, like the flu does, is not very large, but that's not very easy to predict. There are people who've looked at that, maybe someday, but that's outside of our ability. And so we have to have the tools when it does cross over to see, wow, if you're seeing human-to-human transmission, particularly respiratory transmission, then the world has to go on red alert. And parts of the world went on red alert in January, and parts did not. Yeah, for surveillance, you probably do want to go out and almost randomly pick people, even asymptomatics, to see if you're missing something there. And our foundation, with partners in the Seattle area, actually has that going on. We took a flu study that we were doing before and repurposed it. Actually, that flu study was the first to see community spread of coronavirus in the U.S. and should have been a red flag when that was seen. In any case, the testing is very key. The only reason we talk about what you do if you can't get a test is that demand will exceed supply. Even as we get organized with more capacity and we're doing the prioritization, not everyone will be able to be tested. I mean, people are so concerned now that if you really could test everybody, that would be nice, but we don't have 300 million tests available, even if we're doing the right things. Testing is how you know what's going on. That's where you see those red dots. That is the indicator that'll tell you we're not doing enough of a shutdown, or actually now we can start to back off. So testing has to keep going up. Testing is very, very central, but we won't be able to get a test to everybody who just wants that peace of mind, unfortunately. Eventually we may have a strip test that tests for the virus, not for serology. But if it has the right sensitivity, we could have a scale up there. But unfortunately, that's probably 6 to 9 months before we'll have that type of at-home test.